Well, October, it's flown by, but it is still Breast Cancer Awareness Month, and all month long we've been talking to several guests about it. And today, Danielle Holman, a genetic counselor at Franciscan Health Lafayette East, she joins me now. So welcome. Thank you so much for joining me. It's the last day of October. Seems kind of crazy. But so talk to me a little bit about what you do as a genetic counselor.
Of course, and thank you for having me today.
Yeah.
So as a genetic counselor, I have advanced training in genetics and counseling, and really what I do is I see patients both in the cancer center as well as over in maternal fetal medicine, and we break down complex genetic concepts really in a way that's digestible for patients to make decisions really that are best for their health care.
Yeah, and from a patient perspective too, what does that process look like? What can they expect?
Yeah, so I know, speaking a little bit on more of the breast cancer side of things, really when I see a patient, we go over extensively their personal and family history. And then from there we talk a little bit about what the hereditary risk may be, just given that information. From there we talk a little bit more so about what genetic testing is available and what's most appropriate for them. And I really help kind of coordinate that, and once, if they do opt for testing, I go over the results and make an action plan with them based on national guidelines.
Yeah, and what are the benefits of doing that genetic testing too?
Yeah, so it's a tool for their healthcare team. So it's something that can provide them more information on maybe when they should start screening or how should their management continue if they have an active cancer diagnosis.
And what specific types of cancer can this genetic testing help with?
Yeah, I would say currently the tests that are on the market can look at a handful of different risk factors for different cancer types. Our knowledge is not equally spread based on different types of cancer, so things that are a little bit more uncommon or maybe don't have as known genetic cause, we can't do as much testing for them. But for things like breast cancer, ovarian, prostate, pancreatic, etc., those are available for things to test.
Yeah, and you guys at Franciscan, you have the new cancer center too. So
that is correct.
Beautiful facility there too. So what are some of the benefits that you guys have there at that new facility? How's it going? You guys adjusted well to that?
Yes, I would say so far we're adjusting pretty well. We have a lot of providers that are very active in the patient's journey. So for individuals who don't have a history of cancer, that's something that we're able to plug them into the appropriate providers. And if they do have a history of cancer, that's something that we can continue to work alongside their care team.
Yeah, it's a great facility. And for you specifically, like when a cancer is diagnosed with, or when a patient is diagnosed with cancer, like walk me through what you do step by step to be able to help them.
Yeah, so I'm more so on the discussion side. So if a patient presents to me and they have an active cancer diagnosis, we talk a little bit about the likelihood that there could be an underlying genetic cause to explain that. And from there, we talk about what we could be testing for, and really, if we were to find something, what screening recommendations would be recommended, and how that could really impact their treatment even moving forward.
Well, Danielle, thank you so much. It's nice to meet you, and thank you so much for coming into the studio as well.
Thank you for having me.
Thank you.